The Western Cape Blood Service, also known as the WCBS, is one of 2 blood services that operate within South Africa. Donors and patients are its priority, whilst it facilitates the entire process of blood collection, testing, component processing, storage, distribution, and issuing of blood products.
Dear listener, welcome to this episode of the Life Blood Podcast. My name is Thembie Sitsila. I'm one of the doctors here and I head the medical division. And I'm here with my lovely colleague, Dr. Caroline Hilton, who is our lead medical consultant here at the Western Cape Blood Service. So essentially, the purpose of today's episode is just for my colleague and I to discuss some of the questions that the donors have had in the past and just to have a casual chat about it. Yeah, and to share some knowledge.
Okay, excellent. Thanks, Thembie. Let's get going with the first question that we have, which is, how frequently does the blood service review its donation acceptance criteria? I think I can take this one. So basically, we're always in the process of reviewing our donation acceptance criteria. And I think it's quite confusing for donors because we advertise that we desperately need blood and we want people to donate. But when they arrive at the clinic and disclose something that might seem trivial to them, we may have to turn them away. And unfortunately, we do have a list of what we call deferral criteria, which, as I said, are reviewed very frequently. And we usually monitor international donation criteria and general trends in blood safety and risk, and then try and implement these things to make the blood that we collect as safe as possible and for the donation process to be as safe as possible to the donor. So we do review these acceptance criteria quite often. And the next question is, where can people find our current blood donation acceptance criteria? Well, the majority are explained on our website. But if you're not sure about something, perhaps you've started medication that you're concerned about, then you're welcome to give us a call. Just look for our contact details on the website and get in touch with one of us. And we'd happily assist you and to establish whether you can donate. Okay, let's look at the next question.
Great.
What is the acceptable blood pressure to be able to donate blood?
That's a good one. So this is one of the questions that I think I've been asked a few times. So essentially, we take blood pressure readings up to 180 over 100. But the most important thing is that, just to understand, we would never base our decision of whether or not you're permitted to donate on the day on just one reading, because we are aware that there is what they call a white coat syndrome. So people become very anxious when they come to a donation clinic. So normally the sister at the clinic will give you some time, 5 to 10 minutes to relax, and then check your blood pressure reading again. Obviously, she will confirm if you are hypertensive that you have been on medication for at least a month. That's very important. So obviously, if your blood pressure is above the acceptable range, then you wouldn't be able to continue with a donation.
So what do you think, what goes wrong if someone's blood pressure is high? I think that's important for people to know, that if you do have a very high blood pressure and we take blood from you, your blood pressure can drop suddenly, and that can actually put you at risk of having a stroke, for example. So yes, that's one of the reasons why we don't like people with high blood pressure to donate blood.
Yeah, that's a good point. And I think the same applies for the low blood pressure. We've had a few people, particularly the petite-built people, have low blood pressures. When I say low, I mean anything below 100 over 60 essentially is considered low. And the concern there is that if we allow you to donate, there is a risk that we may precipitate cardiovascular events like my colleague mentioned, CVA, so stroke or a heart attack. And that's obviously, we would never want to put you at risk. And once again, so those donors, if you are on treatment and your blood pressure is low, we normally defer you for 7 days. In other words, we say rather don't donate on the day, but we should then try again 7 days later. But if you're not on treatment and your blood pressure is low, we still would say to you, it might be worthwhile to eat a salty snack, particularly before donation, and for us to check your blood pressure again.
Yes, that's a good message to donors, to have something to drink and a salty snack before you donate, ideally about sort of half an hour before, and that can boost your blood pressure. But if you do have low blood pressure, even actually normal blood pressure. And that's been shown to reduce your risk of fainting. So that's quite good advice.
Caroline, I actually had an interesting question from one of our donors last week, and he has recently had a pacemaker inserted, and the concern was whether our automated blood pressure monitoring machines are accurate in monitoring blood pressure. And I think the message I want to relay is that yes, those are accurate and safe, but remember that the measurements we do at the clinic are purely for screening purposes. They are not meant to be diagnostic. So in a clinical setting, a doctor may want to potentially use a different, maybe a manual method, because you want more accurate readings for that specific purpose. But for our purpose, it's purely for screening purposes. So I just want to reassure our donors that yes, we do use machines that are accurate. They give us accurate readings, and most importantly, we haven't received any negative pushback from the doctors, so from the readings we obtain. So yes,
absolutely. And those machines do get calibrated regularly, so they're as accurate as they can be. The next question we have is related to whether people with diabetes can donate blood. And the first question from the donor is, what are normal or healthy sugar levels?
Oh, it's a good question and a favorite one. So normally we encourage our diabetics to check their sugar levels prior to donation, and we say the acceptable range for donation is between 5 and 11, and that's very important. What I think is also important, so donors who are on medication, who are diabetic, who, for example, have had an amputation, there is a bit of a concern there because that speaks to poor glucose control. So they aren't necessarily, or at least shouldn't necessarily consider donating, only because remember the donation process itself causes a lot of stress, increasing your cortisol levels, which can also just increase your sugar levels as well.
Oh, yes. So just to clarify, we don't test diabetic sugar levels at the clinic.
Correct.
Okay. So that's something the donor must take responsibility for and check on the day of donation. So can somebody with type 1 diabetes donate blood?
Yes, someone with type 1 diabetes can donate blood. Essentially, all types of diabetes can donate blood. I think the biggest thing for us is that they are well controlled, but obviously we rely on you. The responsibility would be on the donor to check their sugar levels prior to coming.
Okay, perfect. So I'm just thinking about, it was probably about 2 or 3 years ago where we changed the acceptance criteria for diabetic donors. So previously we did not allow people who were using insulin to donate blood. And the reason for that is that there was an assumption that their diabetes wasn't particularly well controlled. But this deferral criteria was removed. So as Thembie has mentioned, we're happy for any diabetic to donate blood, provided they have good glucose control, they don't have any serious complications associated with diabetes, they feel good on the day, regardless of what medication they're taking. So these days, I know diabetics also take Ozempic and quite a range of non-insulin injectables, and we will happily accept these donors.
On that note, Caroline, maybe can I ask you, so we have quite a few donors who are on Ozempic, but for weight loss reasons. Are we happy with accepting those donors?
Yes, absolutely. So Ozempic doesn't pose a problem in terms of if the drug were to be transmitted via the blood product to the patient. So that brings me to another interesting question on what medications are problematic for donors. And this is a little bit difficult to explain, but essentially we've got certain medications that we call teratogenic, which means that if a pregnant woman were to receive a teratogenic drug, this could compromise the development of her fetus. So we have a strict rule that anybody using a teratogenic drug, and these, for example, are Roaccutane, quite a number of the prostate medications, certain anti-epileptics, there's quite a long list. We prefer people not to donate using these medications. So we do specifically ask you about these medications in the questionnaire, but other medications that we also prefer you not to donate on are those that can affect your platelet activity, such as aspirin and the non-steroidal anti-inflammatories. But just, I think the message here is please disclose any medication use when you complete your questionnaire so the professional nurse can discuss these with you and establish whether it is safe to donate. So I've digressed slightly, but that's just to say Ozempic is not a problematic medication to donate on.
I think just one last question on the medication part. What if a donor donates and then suddenly recalls much later, post-donation, that they forgot to mention that they're on a particular anti-inflammatory or took the anti-inflammatory a day prior to donation? Is there a number they can call, or what do they do in those instances?
Yes, absolutely. So this pertains to any reason why you perhaps are concerned about the safety of your donation. You're always welcome to contact us after the donation, and we will treat your disclosure absolutely confidentially. And you can let us know what your concerns are, and then we can decide whether we need to recall your donation or how to proceed, what risk there is to the person receiving your blood product. So I would definitely encourage you, and we realize, sometimes you just forget about things. It's not deliberate, to always contact us, and then we can decide what's in the best interest of the patient. So it's very important to know there's a person at the end of the line who is in a vulnerable position if they need a transfusion, who's receiving your blood product, and we always need to think about them and their outcome.
Perfect. So in line with the blood safety, one of the most common questions we get as well is with regards to HIV. So I just wanted to find out from you, can someone with HIV or who's on treatment for HIV donate blood?
Unfortunately not. So if you are HIV positive, even if you're on antiretrovirals and your viral load is completely suppressed, there still is a risk of HIV being transmitted in your blood product. So we do not accept any donor who is HIV positive, regardless of what their treatment is. So that's a definite no.
Okay. And is there any risk of getting HIV from blood donation itself?
So there is a possible risk, but it's really important to look at the ways that we try and prevent that risk. So the risk, I think, through statistical calculations is the risk is about 1 in 10 million blood transfusions. But I would like to explain that the testing that we use for all blood donations is extremely sensitive, and it's called nucleic acid testing. And that's it's the most sensitive HIV testing available. And so every single donation gets tested by nucleic acid testing for HIV, hepatitis B, hepatitis C, to identify these potential infections in blood donations. Another thing that we're very careful of is screening our donors in the questionnaire process. So we try and identify any donor who's been in a potentially high-risk situation where they could have acquired HIV. So this usually relates to interaction with sexual partners, new sexual partners, perhaps tattoo use, healthcare workers who might have had needle stick injuries, etc. So this is screened for at the beginning, and then we do test the blood. So I just want to explain the risk of a window period infection. So the testing mechanism that we use will pick up HIV in the blood only 4.6 days after it's been acquired. So there is a theoretical risk that if somebody donated blood 2 or 3 days after they acquired HIV infection, there is a risk that this could be potentially transmitted in the blood product. So that is something we're very concerned about, and which is the reason why we do go into some quite personal questions about sexual activity and lifestyle behaviors for people who want to donate blood.
Okay. So if I donate blood today and it turns out that I am HIV positive, how am I going to know? Who's going to let me know?
So we will definitely contact you. And I really want to assure all our donors that if you test positive for any of the infections that we test for, you will be contacted. It's our responsibility and our ethical duty to let you know if we come across a positive infection result. So you definitely will be contacted. And I just want to urge you to please when you do donate blood, to record correct and accurate contact details so that we can contact you easily. But please be assured, and we do try numerous times to contact you, so it won't be a single phone call. We'll make a concerted effort to get in touch with you, and then also assist you. We can provide you with counseling and help you get to the correct place of care.
I think just to also emphasize that for our regular donors, it's very important. So our returning donors, it's very important to update your contact details and to make sure that these are correct every single time that you come and donate, because it becomes important when we have to get a hold of you to discuss these results.
Absolutely.
All right. So another interesting topic that we frequently get asked, mainly by clinicians actually, is with regards to Jehovah's Witnesses. So what is it exactly, or what's the concern when it comes to blood products and Jehovah's Witness patients?
Okay, that's a very interesting question. So the Jehovah's Witness faith is essentially, it's a type of Christianity where, according to their belief, they should not receive blood products. And this is based on certain biblical references from, I think, Leviticus and Genesis, as far as I'm aware. And we absolutely respect that. And we try and assist the clinicians when they are in the position where a patient who is a Jehovah's Witness believer requires a blood transfusion but refuses this. And usually what I can recommend is that a very honest and thorough conversation is had with the patient, because some people will accept certain blood products and others will flatly refuse all blood products. And that is absolutely their right, and we respect their choices completely. The best way to deal with this is to make contact with the hospital liaison committee for the Jehovah's Witness community. And these contact details are available on their website, jw.org, to have somebody to mediate this discussion and just to support both the patient and the clinician when the situation arises.
So now that it's festive, I mean, we have quite a few donors who will be having a lot of fun. And that brings us to the topic of cannabis.
Oh, yes.
Yeah.
So Thembie, what is our policy about cannabis use?
Yeah, so in the past, these donors weren't permitted to donate. Now we are allowing you to donate, but obviously on the day we'd have to make sure that you're not acutely intoxicated.
Okay.
Yeah.
Okay, so that's great. So, I mean, these days cannabis is used so widely in oils, in inhaled edibles, etc. So I think our initial reservation about cannabis is that it can potentially, we were a bit worried about giving blood specifically to vulnerable patients because an element of the cannabis could cause respiratory depression. And this was a theoretical risk, but we realized that this is probably an overreaction or maybe an overly cautious approach. And we compared this deferral with multiple international donation centers across the world, and nobody else was deferring the donors. So we decided to remove this. So you can happily enjoy your CBD oils and still donate blood.
Yes, please do. And then our favorite topic, vaccinated blood. So we've received quite a few queries and concerns from our vaccinated or non-vaccinated donors who are concerned about whether or not is there a separate pool that's available of essentially non-vaccinated blood. What are the options?
Okay, so you're referring to the COVID vaccinated.
The COVID vaccinated,
okay.
Sorry.
Okay.
Right.
Now that is a really good question. And I think it is something that we regularly are contacted about. So we do not have a separate blood supply in the event that you as a patient could want or request COVID unvaccinated blood. So it's actually not even something that we ask donors to disclose when they come and donate blood. So we don't know this information. And the reason for this is that we don't perceive COVID vaccinated donors to pose any risk to a patient. So we don't have a separate supply. There are some ways around this for people who are absolutely insistent. And this is through what's called a designated donation, which is actually your department, Thembie. Do you want to give some insight into what a designated donation is for people who want unvaccinated blood?
So essentially, a designated donation is if you specifically have people that you've identified who you would like to receive their blood donation for surgical purposes or whatever surgical reason that would require a blood transfusion, you're welcome to contact us and we will give you information. But essentially, whoever you identify would also have to be screened and would have to be the correct blood group as well. So it's the same procedure, but obviously these are individuals that you know who would also be non-vaccinated individuals.
Okay, yeah, and that would only really be applicable in an elective surgery setting.
Yes, correct.
So it's not an option in an emergency situation where you need blood quickly. That wouldn't be feasible. Unfortunately, you will need to access the normal blood supply. Mm-hmm. And I think also it seems like quite a simple solution to satisfy the needs of the vaccine hesitant community to have a separate supply. But it really is not a feasible solution in an environment such as ours, where we already struggle to meet, not struggle, but have a very complicated, logistically challenging environment just to meet the needs of the normal blood supply. To have a separate inventory would be extremely complicated. And as I said, it's not something that we believe there's risk in, although we do respect that other people may be vaccine hesitant. We can't justify having this service, in my opinion.
So Caroline, can I just check with you, is there any risk of getting COVID or COVID transmission through a blood transfusion?
As far as I know, and I do monitor the transfusion literature very closely, there's not a risk of getting COVID through a vaccinated blood product.
Okay. And then last question, what are the other international blood services doing? Do they have a separate inventory? How are they approaching?
No, so it doesn't seem like they have. Nobody has. I even think that the option of designated donations is something quite unique to our environment, which I haven't seen in other environments. I actually have a friend in New Zealand who is an orthopedic surgeon, and I think he had a young patient who needed blood, and the patient's parents were vaccine hesitant and would not let the child get blood, and he actually had to get a court order to get the transfusion done. So as far as I'm aware, I think we probably are on the more lenient side than other international blood services, but this is something we'll have to watch.
Great. Any closing comments from you?
No, just as always, thanks so much to our donors in the Western Cape who just keep us going and are supporting the lives of the patients in all the hospitals, and wishing everybody a relaxed and happy festive season.
Agreed. And I think I want to encourage the donors to please keep sending these questions. We would love to hear from you. And it's great. It also allows us an opportunity to make sure that we are doing the best that we can to answer them, and that information that is out there is clear enough as well. So thank you so much. Have an awesome festive. And yes, please be safe. And remember to donate.
Thank you for listening in. Until next time, do something remarkable. Donate blood.